Hi there. Welcome to the channel. My name is Alana, and I'm the creator of the Health Analytic Insights podcast, where I interview guests and talk all things health informatics. So in this video, I'm going to give tips to transition into a health informatics role if you already have a clinical or IT position. And this can be roles like a help desk support technician in the hospital, or a nurse or pharmacy technician in the hospital, or a project manager or business analyst who works at healthcare organizations. So tip number one is to have conversations. One of the unique advantages that you have if you already have an IT or clinical role in the hospital is that you can easily connect with colleagues in your organization. And so I would suggest reaching out to IT or the clinical decision support department if you have one in your healthcare organization and seeing what technical skills are required of someone in a health informatics role. And you might even have the opportunity to job shadow someone already in this role, because sometimes we see these descriptions advertised and it might be slightly different than what the job actually entails. So having that opportunity to actually go through a day-to-day job of someone in this role can even see if this position is right for you. Tip number two is to start self-learning. So once you get an understanding from having these conversations either with IT or the clinical decision support department about what technical skills would be necessary for this role, you might want to start self-learning and take this initiative on your own to fill those technical skills that you might not have currently. And this could be anything from, going on YouTube where there's many videos on SQL, and I will link those in the description box below because that is a commonly used skill by health informatics professionals. It could be taking courses online through Udemy or Coursera, and it could even look like potentially getting a master's in health informatics. So when it comes to filling these technical skills, I would really take it on your own to start self-learning and see what the gaps are in your own knowledge. So tip number three is to take initiative. A little known fact about me is I'm the creator of the Health Analytic Insights podcast, where I interview guests and talk all about the field of health informatics. And I had the opportunity to interview Jennifer Lewis, who is the Informatics Life here on YouTube, and I will link to her channel in the description box below. And she told me that when she was transitioning from a nursing role to a nursing informatics role, one of the things that she did was to take initiative. And she noticed a communication gap between the day shift nurses and the night shift nurses, and she created a document to help facilitate this issue that she saw in her day-to-day work. And so she was able to bring this up in her interview when she was getting a position in nursing informatics. And so my advice would be to look at your own day-to-day job, see if there's any frictions, barriers to friction in your day-to-day job, see if there's any tools that you could build to automate processes that are often quite cumbersome, and make sure that you are showcasing and telling people about this tool that you have built, because this can really help transition you into a health informatics role. So tip number four is to become a super user. And this can look like you being trained in, for example, the EHR or EMR system in your healthcare organization, trained by vendors and having access to extensive documentation. And this can result in you becoming the go-to person when it comes to issues in technology. And so you're already halfway into that health informatics role because you'll have a unique perspective from the clinical side, then you'll also be trained in the technical side. And you can even become something like an Epic analyst or even have a health informatics role within your own hospital. So this really can open up doors when it comes to having this extra training. So to wrap up, when it comes to transitioning to a health informatics role from your current role, I would suggest taking initiative by having those conversations with IT or your clinical decision support department and understanding the technical skills that you might need. Once you have an understanding of that, I would either start self-learning, developing a project or portfolio that you can talk about during the interview, or going the academic route and getting your master's in health informatics. You can also become that go-to person when it comes to technology by looking for the issues in your day-to-day job and seeing what tools that you can create to automate processes. And finally, you can become a super user and really learn the hospital or healthcare systems to the best of your knowledge. So I hope these tips have been helpful and can help transition you into that health informatics role. And I would love to hear from you. If you made that transition, that jump, what was the most useful tip that helped you get to that position? In the description box below, I have a free guide on how to jumpstart your career in health informatics. Thank you for listening, and I hope you have a wonderful day.